Thank you, Mr. Chairman. Good morning. Dr. Joe Kander, State Health Officer, LDH.
Hi, good morning. I'm Teresa Sokol. I'm the state epidemiologist with the Louisiana Department of Health.
All right. Would y'all like to make an opening statement, Doctor, or we just want to go to questions?
I don't think so. I think we'll just respond to
Okay.
questions.
I know Representative Eccles is the brought this to me. Representative, you want to go ahead and start off the questions?
Certainly. I've got one simple question to start. Could you kind of outline the general process by which vaccine injuries are reported to LDH and what you have communicated to the medical community and whatever hierarchy it is to get that information back to you? I'm going to start there and then I'll come back in a minute.
Sure, happy to answer that question. So we knew at the beginning, when we first started rolling out the vaccines, how important tracking severe adverse events was going to be. We utilized what we have, a 1-800 number where an epidemiologist on my staff, thank you, answers the phone 24 hours a day, 7 days a week to accept urgent reports such as these. So what we did was, beginning in December of 2020, we sent out a health alert to all of the providers statewide. We outlined what the reporting system was. We outlined the type of severe adverse events that we wanted to be reported that might be associated with the vaccination, and we asked them to do so. We have another way of reporting as well. A lot of, and let me say, our 800 number has been utilized by physicians throughout the state for more than 20 years. It's a reporting mechanism that they're very familiar with. They're also very familiar with our regional medical directors and our regional epidemiologists in the Regional Office of Public Health, and so sometimes reports will go directly to those folks, and then we have a sort of a centralized coordinator and a centralized data management system where we collect the data and use it for generating reports.
So I'll be a little more specific in my next three questions. How are you communicating with hospitals to report any issues that happen with vaccines?
So we have different systems for providing that information. I would say the health alerts that we sent out that go to all providers, they go to all healthcare institutions throughout the state. We have sent 5 such reports between December of 2020 and March of 2021, May of 2021 actually, that have really encouraged this reporting, that have described how physicians and other healthcare providers should report, and have encouraged them to do so, tell them what we need. So
hypothetically, if I had, say, 10 hospital CEOs in here, they would know specifically how to report these issues.
They certainly should, because we've sent that information out several times. And I know that the information has gone out as well when our regional medical directors meet with healthcare providers in the community, when Dr. Cantor meets with the CMOs. This has been provided in other ways as well.
So Dr.
Yes.
Cantor's providing this to all those leadership level folks as well as Okay, let's talk about providers now. You mentioned before there were several times that this information has been provided, both on a regional, I guess, on a statewide basis. Kind of detail that so we know specifically how the providers would have received this information, whether they participate in the Medicaid program or not. I'm talking about holistically all across the healthcare system.
So the Health Alert Network system is a system whereby we communicate urgent messages to healthcare providers statewide. And typically they will receive it by email, and there is a notice that this is an urgent health alert from the Louisiana Department of Health, and then there's additional communication that specifies exactly what we're trying to communicate.
So doctors should have received this many times. Hospitals should have received this many times. How about other healthcare professionals, nurses, support staff?
Those generally are, when we're sending out a health alert, what we do is we make a determination as to which sort of healthcare providers should receive it, because we can break that down. When we send something like this out, we send it out broadly.
And then as you've communicated this and as you constantly communicate with healthcare professionals, have you gotten any feedback or even found of any, I guess, difficulties healthcare providers, hospitals, or anyone have had reporting these vaccine injuries?
I have not received any report.
So no reports. Thank you. And then just for the general public's knowledge, what is that phone number?
It's 1-800-256-2748.
And so when did this process start? How many months ago?
Started in December of 2020 when the vaccines first started rolling out.
So we're coming up on month 19 or 20 or 21 of roughly having this reporting?
Well,
Oh, no, 2021?
I'm sorry, no, December of 2020.
2020?
We're in November of 2021, so it's about 11 months.
Okay. All right, so we've had this for about a year then. In that time, how many injuries have been reported?
How many have been reported?
Yes, ma'am.
So the total number that have been reported is 122. And then we investigate each one.
Okay, and then of the 122 that have been reported, how many are deemed severe?
We have had, so what we do is we establish a case definition. So because what we do is, as you noted, we want to make sure what we're reporting out are severe adverse events. And so typically there are different types of clinical manifestations, but they all require hospitalization or they would result in death. Those are the ones that we're counting as severe adverse events.
How many deaths have there been?
There have been none. We have had no deaths that have met our case definition.
Okay. And then for me, and maybe some of my colleagues, could you really simplify these severe events and then how you have, I guess, classified those just so we understand exactly what's happening when there is an injury and what you deem an injury?
Okay. So essentially what we're looking at is some sort of anaphylactic reaction. This is one of them, and that's a severe allergic reaction that requires hospitalization. That type of reaction is going to happen immediately, usually within a number of hours after the vaccination. We have had one such event that we have, upon review of the medical record, that has met our criteria for inclusion. We have another category which we sort of call other, and it could be some sort of delayed allergic reaction. It could be, for example, a Guillain-Barré type of syndrome, but it also requires hospitalization, and we typically would want to see that within a number of days. We're typically not looking at something that's where you're going to have an onset of symptoms 3 months following the vaccination. We also you've probably heard about myocarditis that's been associated with some of the vaccines, and also as well the sort of blood disorder, the thrombosis with thrombocytopenia. So those are included in our case definition as well.
So that's the severe category. Of the 122 that were caught and reported, of the severe category, what's your case count of those three: anaphylaxis, myocarditis, and anything else that's in that other column?
I don't have that breakdown right now as to how many have been reported according to each category. But
well, I'd asked this question, and as of October 27th, they said it was 1 anaphylaxis, 6 other, and 3 of the heart condition. So
oh, yes.
10 total that meet the definition according to the division.
I'm
so
sorry.
That's all right.
I thought you were asking about the total number that have been reported. Mm-hmm. The number that we have counted as severe adverse events that could potentially be related to the vaccine, we have a total of 11 now. So
11
we've had
now.
one
Okay.
since you last got it.
And so does this data, do you roll this back up to CMS or any other reporting agency, CDC?
Yes, absolutely. It's reporting through VAERS is required. And so one of our follow-up questions when we're working with providers and collecting additional information is whether or not a VAERS report has been submitted. And if one has not, we do it ourselves.
So I know there's been concern about vaccine and then the ability to potentially maintain a pregnancy. I know that's been something that's gone out there and has run through the circles. When you start looking at this, is there any reporting requirements through OBGYNs for loss of child through some issue that's happening? Have there been any monitoring in that space to ensure that there are no anomalies in the data?
So that would be one of that should be included. We're asking for reporting of severe adverse events across any individual. Mm-hmm. And so certainly if one of our follow-up questions, when we review these reports. We do an extensive review of the medical records. And so if we were to see any sort of adverse event in a pregnant woman, that would certainly be something that's flagged.
So in the insurance world, the data is the data, this is the data, and you can watch trends based on the claims information that I'm sure you guys get to look at within your data logs. And I'm asking for this information in the future. Could you analyze the data that you have within claims or reported events to determine if there are any anomalies in that data as it relates to people losing a child? Statistically, a higher variance than what you've seen over the last 10 years?
Specifically related to the vaccine, I can tell you we are tracking severe outcomes related to pregnancy associated with COVID-19 infection.
Sure. And y'all have reported on that, so I have all the information I need there. But I'm asking specifically towards, today we're talking about vaccine injury, and that's why I'm trying to go towards vaccine injury. If there is something there, this is brand new, and again, we're just watching data for any oddball trends that are out there, because again, we want to protect our constituents in one form or another. I'm going to leave it there for now. I'll have some more questions in a minute. Thank you.